After age 70, 7 silent signs of anemia. The reasons you are always tired, dizzy, and prone to falls. Introduction. Do you often feel exhausted even after getting a full night's sleep? Do you feel dizzy the moment you stand up? Do you find yourself out of breath after walking just a few steps? Or do you sometimes feel your heart racing for no apparent reason? Many people assume these are just natural signs of getting older, but in reality, these symptoms often stem from a very common condition in older adults: anemia. Anemia is not a single disease. It is a condition where your body does not have enough healthy red blood cells or enough hemoglobin to carry oxygen to your organs. When oxygen levels drop, your heart has to work much harder. Your brain becomes less efficient. Your muscles tire out faster. And your entire body begins to send out warning signals. After age 70, the risk of anemia increases due to many factors. It could be a lack of iron, A, deficiency in vitamin B12, a lack of folate, chronic kidney disease. Long-term blood loss, or other underlying health conditions. The concerning part is that many people live with anemia for months without even realizing it. They simply think. In today's video, we will explore 7 warning signs of silent anemia and how to recognize them early to protect your health. Sign number 1. Always feeling tired and lacking energy. You might sleep enough, you might eat normally, but you still feel sluggish all day long. Even a small task makes you want to lie down. This happens because red blood cells are responsible for carrying oxygen to every part of your body. When your body lacks red blood cells or hemoglobin, the amount of oxygen reaching your muscles and brain decreases. You will feel a lack of vitality, slower at performing tasks, quickly exhausted, and a loss of interest in daily activities. Many people try to drink more coffee or energy drinks to compensate, but if the cause is anemia, these fixes only provide temporary alertness and do not solve the root problem. If your fatigue lasts for several weeks without a clear cause, please see a doctor. Sign number 2. Dizziness or lightheadedness when standing up. You are sitting down. When you stand up, everything suddenly goes dark. You have to grab onto a table. Many older adults experience this. One of the potential causes is anemia. When the oxygen flow to your brain drops, especially during a change in posture, you may feel blurred, giddiness, a loss of balance, or like you are about to faint. Of course, dizziness can also be caused by low blood pressure, but if this symptom happens frequently, you should discuss it with your doctor. Do not just brush it off as a normal part of aging. For those over 70, dizziness significantly increases the risk of falls and bone fractures. Sign number 3. Pale skin, pale lips, and pale fingernails. Have you noticed your face looking more washed out lately? Maybe your loved ones have mentioned that you look a bit ghostly. Or when you look at the inside of your lower eyelid, you notice the healthy pink color is gone. This could be a sign of anemia. When the number of red blood cells drops, the amount of oxygen-rich blood circulating near the skin also decreases. Your skin may appear pale, your lips might lose their natural pink hue, and your fingernails might look unusually white. However, everyone has a different natural skin tone. Therefore, you should not rely solely on appearance to make a conclusion. If pale skin is accompanied by fatigue, dizziness, or shortness of breath, you should get a blood test. Do not buy blood supplements. There are many different types of anemia. Each type needs to be treated according to its specific cause. Sign number 4. Rapid heartbeat or palpitations. You are just sitting and resting. You are not climbing stairs. You are not doing heavy yard work. Yet, you feel your heart beating faster than usual. Or sometimes you get a fluttering sensation in your chest, like your heart is pounding. Many people think this is just anxiety or stress. Actually, when the body is anemic, the amount of oxygen delivered to the organ to compensate, the heart must beat faster to push more blood to the brain, muscles, and other tissues. Initially, you might only feel your heart racing while walking. Later on, the symptom may occur even while you are resting. If this continues, the heart is forced to overwork for a long period of time. This is especially critical for those who already have cardiovascular disease. Of course, a rapid heartbeat, but if palpitations come along with fatigue, pale skin, or dizziness, anemia is a cause that must be considered. Do not buy heart supplements yourself. Let a doctor find the true cause. Sign number 5. Shortness of breath when walking or doing light chores. You used to walk for 30 minutes every morning, but lately you have to stop after just a few hundred yards. Or even sweeping the house or watering the plants makes you feel winded. When the body is anemic, the oxygen supply to the muscles decreases. To make up for it, you have to breathe faster. That is why many people with anemia feel short of breath even during mild activity. This symptom is very easily confused with lung or heart disease. In fact, shortness of breath can come from many different sources. The important thing is not to self-diagnose. If your ability to move around has significantly decreased over a few weeks or months, go get a checkup. A blood test, combined with a heart and lung exam, in particular, if shortness of breath happens while you are resting, or if it is accompanied by chest pain or fainting, go to the emergency room immediately. Sign number 6. Hands and feet are always cold despite normal. Do you often have to wear socks even when everyone else feels comfortable? Or are your hands always chilly even when the temperature is not low? Many people assume they just have poor circulation. That might be true. But anemia is also a cause that needs to be considered. When the body does not have enough red blood cells to transport oxygen, the blood prioritizes vital organs like the heart and brain. Your hands and feet may receive less blood flow as a result. The outcome is that you constantly feel cold in your extremities. Some people also feel a slight tingling in their fingertips, brittle fingernails, or dry skin. These symptoms are not exclusive to anemia. They can also be found in peripheral arteries. But if cold hands and feet are accompanied by fatigue, dizziness, paleness, or a rapid heart rate, please be proactive and get checked. Do not just rely on gloves or products advertised to improve circulation without knowing the real cause. Sign number 7. Difficulty concentrating and poorer memory than before. The brain is one of the organs that when the body is anemic, the oxygen flow to the brain also drops. Initially, you might only feel harder to focus, tired. Many people believe this is just a normal sign of aging. But if these changes appear alongside signs like fatigue, dizziness, shortness of breath, or pale skin, you should not ignore them. The good news is that, in many cases, once the cause of anemia is properly treated, a person's concentration and energy levels can improve significantly. Do not automatically assume that every sign of memory loss is dementia. Some common causes of anemia in people over 70. Anemia is not a standalone disease. It is a sign that the body is facing an underlying issue. One of the most common causes. This can happen due to an inadequate diet or long-term blood loss from the digestive tract. The second cause is a deficiency in vitamin B12 or folate. These are two essential vitamins for the production of red blood cells. After age 70, the ability to absorb vitamin B12 often decreases, even if the diet is sufficient. The third cause is chronic kidney disease. The kidneys produce a hormone that, when kidney function declines, the body may produce fewer red blood cells. The fourth cause is chronic inflammatory diseases or long-term infections. These conditions can interfere with the blood production process. Additionally, certain bone marrow disorders, liver disease, cancer, or medication side effects can also cause anemia. That is why you should not take blood supplements without knowing the cause. Treating the right cause is always how to prevent and detect anemia early. The great news is that many cases of anemia can be detected very early. The first thing is to maintain a balanced diet. Please include foods rich in fish, animal liver, if appropriate for your health and advised by your doctor, beans and legumes, and dark leafy greens. Additionally, vitamin C from fresh fruits. The second thing is to ensure enough vitamin B12 and folate. These nutrients are found in meat, fish, eggs, milk, and some fortified foods. If you are vegetarian or have digestive issues, talk to your doctor about the risk of deficiency. The third thing is regular health screenings. A simple complete blood count test, or CBC, can help detect anemia even when symptoms are very mild. The fourth thing is to never ignore signs of blood loss. If you notice black stools, blood in your stool, blood in your urine, or prolonged bleeding, see a doctor immediately. Finally, follow the treatment plans for chronic conditions like kidney disease, liver disease, or digestive disorders. Summary. Anemia is a very common condition in people over 70, but because symptoms often develop gradually, many people only discover it when their body has significantly weakened. Today, we have explored 7 warning signs of silent anemia: persistent fatigue, dizziness when standing up, pale skin, lips and fingernails, rapid heartbeat, constantly cold hands and feet, reduced concentration and memory. If you notice several of these signs appearing at once or lasting for many weeks, please do not just think it is an inevitable consequence of getting older. A simple blood test can sometimes help identify the cause early and provide an opportunity for effective treatment. Thank you for. If you found today's content helpful, please share this video with your loved ones and friends, especially those over 60 or 70, so more people can recognize the early signs of anemia. Do not forget to hit like, subscribe to the channel, and turn on the notification bell so you do not miss our next videos on senior health. Note: the content in this video is for informational and health education purposes only and does not replace professional medical advice, diagnosis, or treatment. You should not self-supplement with iron, vitamin B12, or blood-building products without identifying the cause of the anemia. If you have unusual symptoms or abnormal test results, please consult your doctor for proper treatment guidance.